Hello friends, welcome back to my channel. Today we will learn in detail about the landmarks of the upper limb bones. So I already have a video which is I talk about the all bones in our body, almost all bones. We will talk about the names and their placement. So I will put the link of the video here or here on the screen. But if you want to learn more about the detailed bony landmarks of upper limb, so this video will helpful. And before we start the video, if you find this video helpful, don't forget to like the video and also subscribe to our channel because it helps us a lot. And let's start. So today we will talk about 7 parts or 7 bones. So the first one is scapula, then we have clavicle, we will talk about then about humerus, radial bone, ulnar bone, carpal bones or wrist bones, and then we have bones in the hand. So we will start with the scapula. Scapula is a triangular shaped bone which we find on the posterior part of our body. So scapula also have two faces. We have anterior part, we have posterior part. The anterior part is called subscapular fossa, while on the posterior we have 3 processes. The first one, which is on the posterior side, called spine of scapula. It's like a line that comes outward. Then the elongation of spine of scapula, call it acromion process. The third process is a coracoid process, which is come from the lateral and then it goes anteriorly. Then we have a 3 border. We have superior border, we have medial border, and we have lateral border. And we have 3 angles: superior angle, lateral angle, and then we have inferior angle. And we have 2 notches. The first one, which is between the coracoid process and also superior border of the scapula, call it a suprascapular notch because of its placement. And the second notch, which is between spine of scapula and glenoid cavity, call it spinoglenoid notch. And when we go to laterally, we have glenoid cavity, which is a part of a glenohumeral joint. And when we come forward, we have a clavicle or collarbone, which is in the middle. It's called shaft of clavicle. Then we have 2 heads on the medial side and lateral side. On the medial side, the heads call it sternum head or sternal head because it's next to sternum. And then we have acromion head, which is next to acromion. That's why it's called acromion head of clavicle. And we have some differences in the morphology of the bones in the medial head and lateral head of clavicle. In the medial head, the bones is more thicker and more smaller, while when we go laterally, the bones become more shallower and more thinner, but more broader, wider and more thinner. This is the way that we can differentiate between the medial side and lateral side. And also on the lateral side or lateral head, we have a tubercle which is called conoid tubercle. If we look at the clavicle inferiorly, we have a groove which is called subclavian groove, which is the attachment of subclavian muscle. And we have some lines of different attachment. And then we come more laterally and downward, we have a humerus bone. On the humerus, we have the head of humerus. Then we have an anatomical neck just distal to the head. And then we have tubercles, greater tubercle, which is more lateral and bigger. And then we have lesser tubercle, which is more medial and smaller tubercle. Between these 2 tubercles, we have intertubercular sulcus. Then we have a surgical neck. The intertubercular sulcus, when it's come more downward, it's make a medial lip and lateral lip. Then on the distal part of the humerus, we have a condyle, and on the sides of the condyle, which is they are a little bit upper, we have medial epicondyle and lateral epicondyle, and we have ridges on top of them. We have a lateral supraepicondyle and we have medial supraepicondyle ridge. Then here we have two fosses on the anterior part. We have radial fossa and we have coronoid fossa. On the posterior part we have olecranon fossa, and then we have a notch. We have capitulum notch attached to the radius, and we have trochlea which attached to ulna. And then here we have two bones. We have radial bone and we have ulnar bone. Radial bone is smaller on the upper part, then when it comes downward it becomes larger and wider, while the ulna is larger and wider on the upper part, and when it comes downward it becomes more smaller. Ulna has a process which is called olecranon, which it goes posteriorly and attached to the humerus by a trochlear notch, which is inside of the olecranon. And when we come downward on the lowermost part, we have ulnar styloid process. Then we come to radius. On the radius, on the lowestmost part, we have in ulna, we have styloid process also in radius, which is, we call it radial styloid process. Then here on the medial side, distal medial side, we have a notch, which is called ulnar notch because it attached to ulna by it, and they make inferior radio-ulnar joint. And then when we come upward, we have a radial tuberosity on the medial side of the radius, and then we have a head of the radius. And this is the forearm bones. Then when we come downward, we have carpal bones. We have 8 carpal bones, which are small bones. And they are kind of too many because they are also small. Sometimes students and even graduate med staff find it difficult to memorize them. That's why there is too many ways to memorize it. So I have my way to memorizing it, and I will share it with you now. From the future, so I ending up not recording that part, so I will tell you now. We divide them into 3 groups. The most lateral one is BTS. Then in the second group, we have LG. Third group, we have HPT. The BTS, B stand for bi. Then we have T. It's mean 2T. Then we have S. The 2T is trapezium, trapezoid. Then we have scaphoid. The second one is LG. L stand for lunate. G stand, it's similar to C. The C stand for capitate. And then we have the third group, which is HPT. H stand for hamate, P stand for pisiform, and T stand for triquetrum. And if you forget the name of triquetrum or the T here, tri means 3, and may help you remember this. That's my way of memorization. And if you have any other ways or know any other ways that is more simple and you remember this way, you can share it with us in the comments down below. And let's continue the video. Then we have metacarpals, which are 5 metacarpals, 1 for each finger. Then we have phalanges. We have 3 phalanges in all 4 fingers, which is proximal, middle, and distal phalanges, except for thumb, which we have 2 phalanges, proximal and distal phalanges. And that's it for today. I hope you find this video helpful, and if you did, don't forget to like, subscribe, and share this video with your friends. Stay safe and see you in the next video.